You are listening to part 48 of our series, 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Thank you so much, Gemini. That was pretty horrifying stuff on what's going on with drug prices, isn't it?
It is absolutely vulgar. I was astounded to hear all that information.
And even though it's been in the news, I don't think that the story what in the news that I saw has been as well presented as that as that Time article. So I really want to thank Time for, alerting us not just to what's going on, but some of the reasons behind it, that it's investment practices, that we're treating it drugs as though they were simply part of the free market, and we simply cannot do that because it's not the kind of thing that works that way. You've been hearing me throughout all of these sessions here as we are in the sixth medicine, pharmaceutical medicine, urging people to back off, to not just assume that drugs are necessary, to see if they can go back to alternative medicine, to herbal medicine, to other kinds of medicine, to mind medicine, to serenity medicine, or lifestyle medicine. Nonetheless, there are 50% of Americans who are taking drugs, and I doubt that they are going to immediately stop taking all of those drugs. So what can we do to keep ourselves safe if we are, in fact, taking drugs? Worst pills, best pills, and I have mentioned this newsletter before, a really excellent little newsletter that you can get, and you can also go to their website, their public citizen group, gives us 10 rules for safer drug use. Notice they don't say safe, they say safer. Rule number 1, have a brown bag session with your doctor. Now, I've seen other articles that suggest that you had the same session with your pharmacist. So I think the take-home point here is there needs to be at least one person in the world who knows every single thing you're taking, every single thing you're taking. Gather all your prescriptions, all your over-the-counter drugs, and all of your dietary supplements. If you take it, even occasionally put it in your brown bag and bring them to your doctor or to your pharmacist and get to work on filling out your drug worksheet. And www.worstpills.org/public/drugs, HEET, drug sheet, will give you your drug worksheet where you're going to put the name of the drug, the date you started or changed the drug, the prescribing doctor, the reason you're taking the drug, the problems or side effects that you need to watch out for with the drug, interactions with any other drugs or food, new problems or complaints that you've had since you started taking the drug, and whether or not the drug is actually working for you. You can see that the drug sheet is a big deal, and especially to get all of this information wakes many people up to exactly what it is they are doing. I just noticed that there's a new startup company which is pre-packaging all the pills that you were supposed to take on a daily basis, prescription, non-prescription, and supplements, so that you don't have to worry about it. You just get that one pack of pills, you open it, and you know that you've taken your pills for the day, no more little marked boxes. I was actually a little bit horrified to consider that. An ongoing record of all the drugs that you are using is the first and the most important step in using drugs safely. It is impossible to overemphasize the importance of this crucial step in preventing adverse drug interactions, reactions, and effects. All right. Rule 1, have a brown bag session with your doctor. Make sure somebody in this world knows every single thing that you are taking. Rule 2, make sure that you actually need the drugs that you are taking. All right? How about a non-drug approach? We've been talking about those non-drug approaches, and once again, here's a mainstream article suggesting that non-drug approaches should be tried first. I am feeling like a very successful woman nowadays. I am feeling like the message that myself and so many other people have been putting out to the medical community, which is, we don't want to take patients away from you. We have the same goal. We want everybody to be healthy. Couldn't we make them healthy with meditation? At least try it first before we start drugging them. And modern medicine is really coming around to understand that much of drug therapy is really not needed. Here's their list of problems that should not be treated with drugs: depression, high blood pressure, constipation, swollen legs, anxiety, difficulty sleeping, particularly in older adults, and the most important disease for which drug therapy is never or rarely appropriate is any disease or adverse reaction caused by a drug. Remember that all drugs are dangerous and many drugs are addictive. Use as few drugs as possible. This is not me speaking. I'm reading from this article. Rule number 3. When starting a drug, begin with as low a dose as possible. Start low, go slow. The older you are, the less of the drug you will need. Start with 1/3 of the usual adult dose if you are an elder or a woman or somebody who cares about their health. There's no reason to start taking the full dose of the drug. This is something that I do all of the time with herbs. You buy a bottle full of herbal tincture at the store, it's going to say, take a dropperful, as though a dropperful was somehow the dose, and that's the dose of all herbs. It's certainly a fine dose of most herbs. There's nothing wrong with it, but many herbs are effective at much, much lower doses. There are a few herbs like hypericum, which we mentioned a couple of weeks ago, hypericum tincture, to help relieve and prevent muscle aches. I definitely take that in dropperful doses and suggest that people take it in dropperful doses for whatever they're taking for. But we also mentioned motherwort to relieve anxiety and to relieve muscle cramping, especially of the uterus, and that's very effective at 3 to 5 drop doses. So what I usually suggest is that people take a 3 to 5 drop dose of the tincture. If that doesn't work, take more. If that doesn't work, take more. Note what amount you took at the point at which it's working. Certainly, it's a little harder with drugs, but still in all, if you are starting a new drug, start low. Take a lower amount of the herb. Pill cutters are available, and see if that's effective enough for you. When you start a new drug, ask right then if you can discontinue any of the other drugs that you are taking. Remember that drug-drug interactions are very real and cause quite a lot of health damage. So if there's some drug that you're taking that you could be off of, given that you're taking a new drug, this is an excellent time to get that happening. Rule 5, talk to your doctor about stopping your drugs regularly, at least every 3 to 6 months. I like these rules. These are very wise rules, aren't they? Don't just say, my doctor put me on this drug and keep taking it. Keep saying to your doctor, do I still need this drug? Is this a drug I still need to take? And I would add, has this drug been changed? Is there a generic version of this drug? Is there a different version of this drug? Now, worst pills, best pills always reminds us not to take new drugs, that the worst effects of a drug are going to be found in the first 3 to 5 years that it is on the market, and so to resist taking any new drug during that period until kind of the shakedown has occurred. But we could still ask, this particular drug, this class of drug that I'm taking, is there a newer version of it that has been on the market for that length of time? Drugs such as antidepressants, sleeping pills, and tranquilizers are not needed beyond a short period of time, and their risk-to-benefit ratio becomes rapidly far more risk and far less benefit. Anytime you can get yourself off of any drugs prescribed for depression, anxiety, sleeping, you will improve your overall health. If you don't feel that you can completely come off of these drugs, ask your doctor how you can lower your dose. And can you lower your dose by a third now and two-thirds in a while? How low can you bring that dose? Can you interface that with better lifestyle practices? Can you interface that with serenity medicine or story medicine, mind medicine, and lifestyle medicine? Remember that these are always there to keep us healthy and to improve our health. Rule 6, find out if you're having any adverse drug reactions. If you develop any new symptom, and this is Rule 7, after starting a new drug, assume that it was caused by the drug. Always assume that new symptoms that you develop have been caused by the drug. You can identify possible adverse reactions by going to worstpills.org and then using the search function to look up the name of the drug. They have details on adverse reactions caused by every single drug. You can ask your healthcare provider if a safer drug can be substituted, or, again, if a lower dose is the way to go. Rule number 8, before you leave your doctor's office, before you leave the pharmacy, make sure that the instructions for taking your medicine are clear to you and to a family member or a friend. Regardless of age, a person's chance of developing an adverse, life-threatening reaction from a dose of a drug not taken before is high enough that at least one other person should know about those possibilities. This is, again, like step number 1, one of the most critical things to do. Don't assume that those adverse reactions won't happen to you. Make sure that at least one other person knows what's happening. Rule number 8, get rid of all of those old drugs. They talk about people holding on to the drugs thinking, well, maybe I'll need this at a future time. In general, it's not really safe to do that. It's not safe to give your drugs to somebody else. It's not safe to resume taking drugs that you took a year or so ago. This article suggests that we just resist temptation and avoid further problems by getting rid of your outdated drugs. Now, of course, that leads one to say, how do I get rid of them? And that is indeed a real problem. Many people take unused, unwanted drugs and flush them down the toilet, and thus our water supplies are abundant with a great number of drugs which are impossible to get back out of the water. They could also be thrown in the trash, and that would then be taken somewhere where it would probably be buried and wind up in the water as well. So once we have these drugs, we have to realize that we have problematic substances on our hand, and that getting rid of them is not easy. Some doctors' offices will take unwanted drugs from you and dispose of them in a responsible way. Certainly ask your doctor. And rule number 10, have one person who coordinates your care and your drug use. And we mentioned at the beginning that could be your primary care doctor, or it could be your pharmacist. Pharmacists, in fact, are trained to help people. And so don't feel that you are being pushy or asking for too much if you ask your pharmacist to help you avoid that drug-drug interactions or interactions with any other things, including food. That's what the pharmacist wants to do. Here's a wonderful list of ways to use pain medications more safely. And it's very interesting to see how much of this list overlaps with the previous one. First of all, take your medication only as prescribed, especially with pain medication. You know, people take pain medication, doesn't seem to be working fast enough, then they take another. Or they forget they've taken it and they take another. Or they put on a second patch, unaware that they still have one on their body. This is not so much a drug-drug interaction as it is an overdose of the drug, and there can be serious consequences for it. This is a place where if you are taking a drug at certain intervals, it is excellent to have a chart and simply tick off on your chart when you've taken it so that you don't unintentionally double up on your dose. Be especially cautious when first taking a new medication. Fatal overdoses happen most of the time when people have just started taking their pain medication. Their body is not used to it. They're not used to it. They double up on the dose. Something else happens, and there's an overdose. Before you leave the ER, the hospital, the doctor's office, or the pharmacist, ask. Don't be afraid to ask. What is the name of this medication? Both the brand name of the medication and the actual chemical name of it. What dosage are you recommending, and at what strength? Are there other dosages and strengths available, and why are you recommending this dosage and this strength? Is this a long-acting or a short-acting pain reliever? At what intervals should I take it? Long-acting pain relievers like patches are typically prescribed for patients who require around-the-clock pain relief, and the shorter relief, like over-the-counter non-steroidal anti-inflammatory drugs, are usually for people who do not need round-the-clock relief. Ask your pharmacist about drug interactions. Methadone can be fatal if you're using an antidepressant, an antibiotic, or a cardiac medicine. Doctors say get all your medicines from the same pharmacy, and this way the pharmacy will be in charge of seeing to it that you don't have drug-drug interactions. I've seen several wonderful articles written by pharmacists, and that is their recommendation too. Don't shop around from pharmacy to pharmacy to save money, because the life you may save may be your own by choosing one pharmacy and one pharmacist to get all of your drugs from. You are helping to ensure that you get the best health care possible. Don't take somebody else's meds. A dose of somebody else's painkiller prescribed for one person can actually be fatal to another person. You don't know what other medicines they were taking. Do you know what other medicines you're taking? If you're not taking any other medicines, okay, that's much better. It's not a problem, so much of a problem, but still and all, let's play it safe here. Keep a pain and medication diary. Write down when you take your medicine, how much you take, and what your pain levels are. This will help you to track how well your medicine is working. In 2010, a lawsuit was settled against doctors who treated his wife and gave her lots and lots and lots of pain medication and other medications, which deeply interfered with her ability to lead a full and satisfying life. There's just no excuse for it, he said, and I am glad that this lawsuit has come to this conclusion. All right, let's look at some of those interactions and, again, some ways to minimize our risk of those interactions. Drug interactions occur when a drug, a supplement, or even a food has an effect on the way that your body is processing things. Some interactions make drugs more powerful, some make them ineffective. The term drug interaction can be misleading. It's not like the drugs are actually interacting or combining in the body to produce chemical reactions. No, usually what's happening is that the drug is stimulating or inhibiting specific enzymes in the liver or the intestines, which then cause the drug to act in strange ways. There can be interactions with other drugs, interactions with nutrients, and interactions with your body, as well as interactions with supplements. So 4 types of interactions. Interactions between 2 drugs occur when one affects the enzyme that processes the other. For instance, the antibiotic Flagyl inhibits an enzyme which breaks down warfarin. If the 2 medications are taken together, then warfarin, the blood thinner, will linger in the body and increase the risk of severe bleeding. The anti-seizure drug Dilantin stimulates excess production of an enzyme that metabolizes estradiol, which is a component of low-dose contraceptives. In this case, the contraceptive is cleared more rapidly, and thus they lose their effectiveness. Drugs taken for different purposes may actually have the same effect and produce an overdose. Over-the-counter pain relievers, especially aspirin, ibuprofen, naproxen, and to a lesser extent acetaminophen, when taken with blood thinners, such as warfarin and Plavix, can result in severe bleeding because the pain relievers are also blood thinners. Several foods can block or stimulate enzymes that break down drugs. Lipitor and Zocor are affected by grapefruit juice, and people who drink grapefruit juice and take these statin drugs often experience more muscle pain and other side effects from a statin overdose because the juice inhibits the enzyme that clears the statin from the body. Fish oil supplements have a similar effect when taken with warfarin, leading to increased bleeding, and iron supplements diminish the effect of Synthroid, which is used as a medicine to help deal with an underactive thyroid. About 100,000 Americans over the age of 65 are hospitalized each year because of adverse effects of medications. Just 4 drugs or groups of drugs cause 2/3 of all these hospitalizations. Number 1 is the blood thinner warfarin, which by itself accounts for 2/3 of these events. Then insulin injections, antiplatelet drugs, and oral diabetes drugs. Your body can react to drugs in a very unexpected way. There's more than one version of each of the 50 or so enzymes used to break down drugs. So you can have reactions to certain drugs because you break them down faster or usually slower than most other people do. And as we age, we tend to metabolize drugs more slowly. So a dose lower than the one usually recommended is better. Kidney or liver disease can also slow the rate at which you are metabolizing those drugs. To minimize your risk, because it isn't realistic to expect us to memorize every possible interaction for every medication we take, do these things. 1, know why you are taking each medication and its drug name. 2, know how to take the drug. Should you take it with food? Should you take it in an empty stomach? For instance, tetracycline shouldn't be taken with dairy products because calcium interferes with its absorption. 3, know your pharmacist. The healthcare system is deeply fragmented. Your primary healthcare team is likely to have a record of the prescription, as are all the specialists you've seen, but they're not talking to each other. The pharmacy is going to store all records of all prescriptions they sell, so keep it all in one place. Be suspicious of supplements. The most serious drug interactions involve prescription medications and supplements. Supplements not only are supplements less likely than FDA-approved medications to be listed in the database of drug interactions, but healthcare providers may not know what supplements you are taking. Face it, there isn't much evidence that supplements have health benefits. Again, this is from Harvard Women's Health Watch, a mainstream newsletter. All right. There isn't much evidence that supplements have any health benefits, so you might as well avoid them. Go easy on the grapefruit juice. Have you heard that grapefruit juice can speed up the way that things are metabolized in your body? Well, it's true, but it takes a quart of the juice a day to make much difference. Ask your pharmacist if any of the drugs that you're taking is strongly affected by grapefruit juice. And if it is, just wait a few hours after taking your medication before enjoying your 8-ounce glass of grapefruit juice, but just one 8-ounce glass during the day. Limit alcohol. Limit alcohol. Alcohol is never superb for your health, but if you are taking drugs, there are many classes of drugs that are made far worse if you are drinking. That social glass might be something that you could do occasionally, depending on what drugs you're taking and how often you're taking them. Remember that pharmacists have extensive knowledge of how drugs work, what their side effects are, and how they interact with supplements and foods. Your pharmacist can suggest a schedule for taking all of your pills that will minimize the likelihood of interactions. And some health plans, I thought this was wonderful. So some health plans have medication therapy management, a program that allows an annual in-depth consultation with a pharmacist, and they will usually pay for it. If you are taking one or more medications, you might find out if your health plan has MTM, medication therapy management, so that you can not just go along with what has been prescribed for you, but actually become someone who has ideas about how she wants her own health to be and how she's going to take care of herself. We have covered as much as we are going to cover about both pain-relieving drugs and pain-relieving herbs. And we've taken a little bit of time here to look into some deep flaws in our system of getting drugs to people and to see how we can protect ourselves as well. In our next shows, we're going to go into blood pressure drugs. This is one of the largest categories of drugs used in the United States, drugs for lowering blood pressure. And in the vast majority of cases, Serenity medicine, story medicine, mind medicine, and lifestyle medicine are perfectly adequate to lower blood pressure and to keep it down. We'll be talking about the drugs that are used, what the problems with those drugs are, why we want to reconsider taking those drugs, and then herbs, foods, and lifestyle choices that can keep our blood pressure right where we want it. We are also next month going to be looking at problems with anti-cholesterol drugs. Again, we are looking at drugs, blood pressure-lowering drugs, and anti-cholesterol drugs that are prescribed to millions and millions of Americans. And again, to my mind, quite needlessly. We will look at the cholesterol myth, and we will look at what's going on with cholesterol and why lowering cholesterol may not be the way to avoid a heart attack. And we're going to look at food, herbal, and lifestyle interventions for people with high cholesterol. Lots of yummy, delicious things that we can bring into our diet that are quite effective at lowering cholesterol. In fact, we have a lot of good information about these, and I'll be able to tell you specifically how much garlic will lower cholesterol or blood pressure in how much time, so that we are able to really hone in quite precisely on the foods and drugs, on the foods and herbs that we want to use instead of blood pressure lowering drugs or cholesterol lowering drugs. I'm looking forward to spending that time with all of you, and especially with you, Gemini. Thank you so much for helping me reweave the healing cloak of the ancients and spread the word that herbal medicine is people's medicine. It's the medicine that grows right outside your door.
Thank you so much, Susan, and we look forward to speaking with you next week here at Time Monk Radio. And this concludes part 48 of our series, The 7 Medicines the Wise Woman Way with Susan Weed at Time Monk Radio.